EMT and actor Bobby Sherman said, "Take some time to learn CPR. It saves lives and it works." As a lifeguard and swim instructor, I had to go through 3 days of training for CPR and first aid. Luckily, I had never had to use it on anyone, but having that knowledge of knowing how to save someone's life really made me more confident as being the only lifeguard in the pool. So this end goal here is learning how to do CPR and saving a life. According to the American Red Cross, you would administer 30 compressions and 2 breaths, but according to the American Heart Association, by doing hands-only CPR triples the chance of survival. So if you see someone on the ground, or if you just witnessed someone fall down on the ground and you believe that they've been in cardiac arrest, you want to come up to them, make sure the surroundings are safe for you to continue doing this and for the person. Then once you've seen the surroundings, you want to make sure that they're okay and see if they're not just unconscious or just sleeping. So you shake and ask if they're okay. Shout, "You're okay. Are you okay?" And then what you want to do is make sure to open their airway. So you pull back their head and open up the mouth and look in the airway and see if it's clear. And then once the airway is open, you want to start compressions. So when you're doing your compressions, you want to take your palm and put it right in between their chest on their sternum. And then you want to take your other hand and interlock it with the one in the chest. And you want to have your arms straight and you want to put all of your weight into the compressions. You want to go about 2 inches deep into the chest to effectively get the heart going and the blood pumping again. And you just keep doing that for 100 times per minute or until an AED or the paramedic comes. While doing your compressions and pushing into the chest, you want to have the beat in your mind of staying alive or another one bites the dust. You want to place your hands at the bottom of the sternum where it meets the ribs and start compressing. If you become exhausted while doing compressions, you want to avoid this. They may not be as effective, so you want to switch out with someone nearby to continue your compressions. So before you even start compressions, you want to make sure the scene is safe for you to start doing CPR. You want to make sure that the person's not just sleeping or unconscious by looking for a sign of movement, breath, or pulse at all. Then you also want to make sure that you shake them and ask if they're okay.
Go call 911.
And you want to go tell someone to call 911 and get an AED immediately. And then you want to start those compressions. You want to go fast and hard. You want to go 2 inches deep in the person's chest if it's an adult. And you want to just go as quickly as you can. And you want to wait and continue doing compressions until an AED arrives or a paramedic arrives. You want to avoid using just your arms. You want to use your entire upper body strength. Dr. Michael Sayer, an emergency medicine professor at Ohio State University, says to continue hands-only compressions until a paramedic or an AED arrives. The overall goal here is to keep the compressions going and increase the likelihood of saving the patient's life. Thank you for watching.